Maryland's Governor Larry Hogan has warned the region is still heading up the curve for people to prepare for, quote, dangerous times in the coming weeks. Governor Hogan joins us now from Annapolis. Governor Hogan, let me start with the question State Delegate Mosby asked. What are you doing to protect those minority Marylanders who are so vulnerable?
Well, first of all, this disparity among African Americans is very disturbing. It's why I called for the study. You know, nobody was really tracking these things, and it was difficult to do because none of the federal labs, the CDC, nobody was actually tracking these tests by race. And we went back and actually individually looked all this up, thousands of cases, and we are now, we've got about 80% of those cases done, and it's why you have the information that you're reporting on. We did it better than any state in America. I also have been successful in convincing the federal administration to consider Baltimore and the entire Baltimore-Washington corridor as a hot spot. We've been taking some of the earliest and most aggressive actions in America, and a lot of our focus has been on those areas that you're talking about. It's where our highest population centers are. It is also where we have the highest concentrations of blacks and Hispanics. And so it's Baltimore City, it's Prince George's County, Montgomery County, right outside of the Washington area, and those counties in between. It's about 5 million people in that corridor.
Governor, I know there have also been calls.
We can.
I know there have also been calls for you to release more data by zip code so that the state can direct resources to the hardest hit neighborhoods. Baltimore has started releasing its data. Will you do that statewide?
Yes, we have compiled all the data by zip code. I think it's all going to be released on the website either this morning or tomorrow morning.
And you talk a lot about this information and this data you're gathering. What are you doing with the information to help those communities? How do you use that data to help those communities?
Well, it's where we're directing all the resources. So as you know, covering this story across the country, look, everybody is fighting to save every life we can. We're trying to save the lives of thousands of people in our state, the 6 million people who live here, but the vast majority of our resources are focused on that Baltimore-Washington corridor and these communities that you're talking about. It's where almost all of our attention and all of our focus, all of our money, all of our health care, all the assistance from the National Guard. It's really where all of our testing is being done. It's where all of our health care is being ramped up, where we're adding 6,000 hospital beds. So it's definitely where the attention of the entire state and local governments are focused, and now we thankfully have gotten the attention of the federal government to consider this entire corridor as a place to focus on.
You say that you and many other states are in dire need of more supplies, but listen to what President Trump said on Friday about the needs of the governors.
We're in great shape with ventilators. We're in great shape with protective clothing. We have additional plane loads coming in, but we're not getting any calls from governors at this moment. We're getting very few calls from governors or anybody else needing anything.
You are chair of the National Governors Association. Is that true?
Well, I get calls from governors every single day. We've had 12 calls now with every single governor in America, 8 of which the president and/or vice president was on the call with us. And I can tell you that nearly every single governor, I had a call with the FEMA administrator just yesterday afternoon. Look, I think that we've certainly seen an improvement over the past week from the week before. I know that a lot of people in Washington are working very hard. Everybody has gotten more supplies than we had the week before and the day before. And I know there's people in Washington that are working very hard as partners to try to help the states, but I think to say that everybody's completely happy and that we have everything we need is not quite accurate. I mean, everybody still has tremendous needs on personal protective equipment and ventilators and all of these things that you keep hearing about. Everybody's fighting to find these things all over the nation and all over the world.
And the administration is launching a second economic task force that will focus on reopening large portions of the country. You have said that opening back up is not like flipping a light switch. So do you see it happening in your state May 1st?
Well, we haven't got any kind of an artificial deadline on that. I'm going to look, everybody wants to get the country back on track as quickly as we can, as long as we do it in a safe manner, because we've got this twin problem of this terrible health crisis where we've got, tens of thousands of people dying. And yet, we also have this incredible economic challenge where we got, millions of people that are unemployed and small businesses being hurt everywhere. We've got to balance those needs, but really, right now, the first thing is saving lives and keeping people safe. But we do also have to think about how do we eventually ramp up and get some folks back to work. But you can't just pick a date and flip a switch. I don't think it's going to be that simple.
An advisor to your state task force, former FDA Commissioner Scott Gottlieb, has said the country needs to be able to process 750,000 tests per week before opening back up. The president said he doesn't think that is needed, that large-scale testing. Do you agree? And would you be okay with lifting your stay-at-home guidance without widespread testing?
I think widespread testing and contact tracing is going to be absolutely essential to finding out exactly where we are in this fight against this deadly virus. Dr. Scott Gottlieb is one of the smartest guys in America. He's on our task force. I agree with him. I think most governors agree with that as well. It's something that we're all working hard to do. I believe we are making progress on increasing testing. The question is how fast we can get enough tests up to speed in order to help us get to the point where we are able to do all of those things.
Yeah, that certainly is the question. Governor, thank you so much for joining us this morning.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.